Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna talk about how to stop or relieve patellofemoral syndrome pain. But before I do that, I'm gonna go over the symptoms, the risk factor, the causes, and then we'll go over the steps you can take at home to relieve or stop your pain. So what are the symptoms of patellofemoral pain syndrome? So you might feel pain in the front of the kneecap. You might notice some swelling and weaknesses in the knee muscle. You might have issue with straightening your knee. So you can see in the knee model here, the patellofemoral pain syndrome usually occur around this area. This is the kneecap, the patella bone. You can see it here, the femoral bone in here, and your quad should be up in here, and you have the patella tendon and the patella ligament are here. So usually the swelling around this area and behind the kneecap, and that occur due to muscular imbalance. It's either IT band tightness from the outside of the knee, it's usually on this side, or you might have hamstring tightness that cause a lot of imbalance, or rubbing the patella on the underneath tissue, so it will cause inflammation and pain. And you can see it here in this image. In the left side, that's a normal knee, there's no inflammation, and here you start to see redness behind the kneecap or the patella, and that's due to the rubbing of the patella on the underneath tissue. So what are the risk factors for patellofemoral pain syndrome? Bad shoes could be a risk factor, because when you start to have bad shoes, you will start to activate different muscle that you usually not activated, and cause tightness and imbalance in the knee muscular system. Also, if you have IT band, that's a very common risk factor, IT band syndrome or IT band tightness, and that's usually from the outside of the knee, and when that's tissue tight, it's actually push the leg or the thigh toward the outside and cause imbalance in the muscle, and that could cause rubbing here. So muscular imbalance is very common. Also the hamstring tightness, which is a muscle in the back of the knee, when it's tight, it causes imbalance and actually overstress the quad to work harder to maintain that imbalance from the tightness. The other risk factor is overuse from a lot of jumping, running, and it's very common with adolescents, especially common with women, because they have a wider pelvis. When the pelvis is wide, it usually causes the thigh muscles or the thigh bone or the femur to be angled like this, and that could put stress on the patellofemoral joint and then cause inflammation there. So how to treat patellofemoral pain syndrome? In order to answer this question, we need to understand the normal healing cycle and how to address the healing cycle to get to the root cause of the problem. So I'm gonna use external paper cut for visualization, but the same thing happened internally for the patellofemoral syndrome. So the first stage of healing is inflammation. As you can see here in this image, is swelling, redness, the blood starts to rush to that area, and you start to experience some pain. And especially with the patellofemoral syndrome, you will have a lot of inflammation, and some patients actually they can see that swelling in the front of the knee. The second stage of healing is a proliferation stage. That's when your body starts to build the scar tissue. So there's a lot of rubbing happen in the kneecap and a lot of inflammation, and your body starts to build the scar tissue because you have internal micro tear in the tissue. The problem is when you have a lot of scarring in that area and your body does not dissolve it, that cause more rubbing and actually cause more imbalance in the muscle and get you in a vicious cycle of inflammation and proliferation. During the proliferation stage, there's a cascade of events happen: scar tissue, fascia restrictions, muscle spasm, trigger points. Last stage is a maturation stage. That's when your body starts to heal and clear up anything from the proliferation stage and the inflammation stage. And that could take days, weeks, months, or years. If you have chronic condition, you probably your body going back and forth between inflammation and proliferation stage, and by definition is actually patellofemoral pain syndrome. Usually you have a lot of inflammation internally between the patella and the femur bone, or actually in the front too, and you will notice here that's probably there is a swelling that sticking out in this area. If you have this condition, some people, like you can see visually the swelling, so there is an inflammation in that location, and also at the same time underneath that inflamed area there is a scar tissue, fascia restrictions, muscle spasm, and trigger points. So I want to show you internally when you start to have a scar tissue what to look like. So normally the muscle should look like nice and smooth, like in this image here, the first image on the left. When you start to have tear or injury, that could cause a tear in the muscle or micro tear, and you see it's a random tear. Your body has to build the scar tissue in order to heal. When that happened, it happened randomly, and you see it here, the scar tissue is a very random buildup in the tissue. When you have a lot of scar tissue, that's an issue, because our muscle should act like a rubber band when you contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knot in the rubber band, so your muscle will not have enough range of motion to stretch, and everything is stuck together, and that causes more inflammation, more scarring and tightness in the muscle that get you in that vicious cycle of inflammation and proliferation. So what should we do at home to get to the root cause of the patellofemoral pain syndrome? We have to break that vicious cycle from both ends, because there is inflammation and there is proliferation. So in order to do that, we have to address those end of the vicious cycle. But before I talk about how to get to the root cause of the problem, I'm gonna go over some of the common treatment that been used but are not effective, so you don't waste your time on something that does not work. So what commonly used is ice and heat, especially ice used to decrease inflammation, but based on the study is actually provide a temporary pain relief, and it's does not provide a long-term pain relief or a long-term result for inflammation. The other thing is used as a stim, electrical stimulation, that provide temporary pain relief, and it does not really work on the inflammation or proliferation stage, and if you're lucky you might experience pain relief for half an hour or so. The other thing that commonly use foam roller and massage, and based on the studies, foam roller and massage, it's either provide temporary pain relief or does not provide pain relief. So, and when I go over each of the stages of healing, it will make a lot of sense why massage and foam roller will not work. But here is the issue: if you have inflamed area, do you want to rub it more? If you rub it more, you're gonna cause more inflammation, and anatomically it's impossible to release deep tightness with the foam roller or the massage, because mechanically you cannot go deep in the tissue with the hand or the foam roller. The other thing that's been used by a lot of healthcare providers like physical therapists, chiropractor, occupational therapists, joint mobilization or manipulation or adjustment. And based on the studies, joint mobilization does not provide long-term pain reduction. You will lucky if you get temporary pain relief from it. But when we look at the normal healing cycle, moving the joint will not decrease the inflammation. It will not break the scar tissue, release the fascia restriction. Actually, if you do a lot of mobilization, you might inflame it more. The other thing that's commonly used is stretching. So I personally do not recommend stretching for my patient, because there's other safe option than stretching. Stretching actually, based on the study, could cause more inflammation. And think about this way: you have inflamed area, you have a micro tear there, you have a scar tissue. If you keep stretching, you're gonna make it worse. and overstretching will cause more inflammation and more micro tear. So I personally do not recommend it to my patient. There's other alternative safe option to do than stretching. The other thing that commonly uses strength exercises, we want to do that, but if you do it in the during the inflamed stage, you're gonna inflame it more and will cause more issue. We want to introduce strength exercises when we release the inflammation and the proliferation, but I prefer to do function training because it's much effective than strength exercises. So what should we do to really get to the root cause of the problem? Well, we have to really decrease the inflammation. In order to do that, what I personally do is you need to rest. So you need to avoid the activity that aggravate it or cause more inflammation. If you do jumping or involved in sports, you need to really refrain from the activity that cause more inflammation. Rest, usually if it's a mild issue, a week should be enough. But if you have chronic patellofemoral pain syndrome, you probably have a lot of inflammation and a lot of proliferation, which is scar tissue fascia restriction, muscle spasm. We have to work on both at the same time. So what I do for that, I use the pain relief cream with the Magna Heal Pro on the kneecap to decrease the inflammation. So for mild inflammation, it should take a few sessions to decrease the inflammation. At the same time, I prefer to put all my patients on anti-inflammatory diet to make sure they're not eating the food that cause internal inflammation that slow down the healing. For complicated cases, if you have severe deficiency in vitamins and mineral, your body will be slow to heal. So what you can do now, if you have slow healing, take advantage of Ask ASTR. It's a free online medical evaluation. The software will help you and guide you on the process of figuring out possible vitamins or mineral deficiency, and it's free, and it usually takes 5 minutes to answer the questionnaire, and it's at AskASTR.com. So while we're working on the inflammation stage, we have to work on the proliferation stage to break this vicious cycle. The proliferation stage including working on the scar tissue, fascia restrictions, muscle spasm, and trigger point. So what I personally do is I use the A3 to work on superficial scar tissue, break it, and I use the A5 to break the internal deep scar tissue, trigger point, and fascia restrictions. And that's why I said massage and foam roller are not effective to break deep adhesion, because it's impossible with a foam roller to go deep in the quad or hamstring muscle or the IT band to release it, or even with the hand when you do massage. So what I like to do is go deep, release all this deep adhesion, so you balance the muscular system to decrease the pressure on the knee joint. The other thing that we have to work on, and I will briefly explain it here because it has significant effect on the patellofemoral pain syndrome, is the fascia system. The fascia system, the superficial fascia layer, it's like a wrap surrounding the entire body. It's like a Spider-Man suit covering the entire body. But we have fascia layers that's wrapping a group of muscle, each individual muscle and each individual fiber. So you can see it here in this image, the white filament or tissue here, that is the fascia layer. You can see it in the cadaver here. And next time when you go buy meat, look at the white filament in the meat here. That's the fascia system. And when you have fascia restriction, it compresses on everything underneath it, and it prevents the muscle from fully contracting. And that's why it has significant effect on patellofemoral syndrome, because a lot of this tightness in the fascia layer cause muscular imbalance and shifting the patella bone and cause irritation in that area. So to make things more complicated, but don't worry, the treatment very simple. The fascia system has two major categories: superficial fascia layer and deep fascia layer. And the deep fascia layer divided to 4 subcategories. Each of these categories has 2 to 3 sublayers. So the deep fascia layer divided to 4 subcategories. The first one is the aparatic fascia. The aparatic fascia wrapping a group of muscles. Then you have the epimysin wrapping each individual muscle. The premiysin, a group of bundle of fibers, and then each muscle fiber has a fascia layer that wrap in it. And you can see it here in this image, the epimysin wrapping the muscle here. Then we have the premiysin wrapping a group of muscle fiber, and at the end you have the endomysin wrapping each individual muscle fiber. And that shows you how complicated the fascia system. And in order to really balance your muscle, we have to release all these fascia restriction areas. So what I personally use, I use the A1 to release the superficial and aparatic fascia layer, and then I use the A5 to release the epimysin, premiysin, and endomysin. And that's why I said the foam roller, the massage will not be effective to really go deep to release the fascia layer, because it's impossible with the knuckle to go deep. The A5 we can go deep in the hamstring or the quad muscle, 2 inches to 2.5 inches to really do deep release. And if you don't apply mechanical force to the fascial layer, it's impossible to release it. So to sum it up, what should you do at home? Well, first of all, you need to avoid the motion that's aggravated. And we need to look at your structure, because sometimes you might have foot issue like pronated foot or supinated foot that cause alignment issue in the bone, and that stress your joint and actually cause muscular imbalance in your knee. So we have to correct that. You want to avoid the motion that aggravated, like jumping or running. You want to wear a knee pad if you kneeling a lot, so you avoid too much pressure on the knee. We have to balance the knee muscles, because that's one of the main risk factors. A lot of the time the IT band, the hamstring are very tight. You have a lot of scar tissue, fascia restriction in those areas. Your knee will not be back to normal unless we balance those muscles that put your kneecap out of alignment. While we're working on that, decreasing the inflammation and breaking the scar tissue and fascia restriction, then we do the function training to strengthen your knee muscles. And that's conclude our video on how to relieve or stop patellofemoral pain syndrome. If you have any question or comment, leave it in the comment section below and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astrinstitute.com.